Labor's aged care reforms are now in effect, and it's a move that the Albanese government claims will really provide a financial sustainable industry. But there is concern surrounding the increased cost of basic care, which will potentially come with the changes. So for more, joining us live is aged care consultant Paul Sadler. Paul, thank you so much for joining us today. So, yeah, there's quite a lot to get through, but can you just give us an overview, first of all, on how it's looking?
So the aged care reforms that kick in midnight this morning introduce a new Aged Care Act, the first update to the Act since 1997. So it's been nearly 30 years that we've operated under the old regime. We've got a new Act in place now. That, very importantly, places the rights of older people at the centre of the aged care system. So there's a new statement of rights that is actually embedded into the Act itself. There's then a new registration regime for providers of aged care. There are new aged care quality standards that start today. There's a code of conduct and various other obligations on aged care providers. The other big change that's ushered in today is there's a new support at home program that is introduced, replacing home care packages. Home care packages are currently used by 300,000 older Australians, and they will be replaced with the new support at home program from today.
And we're an ageing population, and this is going to provide money for the government. What's the downside to this for providers and for people using it?
Well, the big downside for people using the system is they're going to be asked to contribute more towards it. So there are new participant contributions that will be required of people using the new support at home program. So older people can be asked to contribute 5% of the cost, for example, of a personal care service, having a shower, if they're an age pensioner, and up to 50% of the cost of the service if you're a self-funded retiree. There's also additional charges for so-called everyday living services, which can range from 17.5% of the cost of a service for a full age pensioner, up to 80% of the cost of the service for a self-funded retiree. The government, though, has made clinical care services such as nursing, allied health, free.
So for people dealing with a cost of living crisis and need these cares, I mean, it might be a 5% increase, but we know so much is increasing little by little. That's potentially, you know, would people not use these services and go without really necessary services?
Yeah, absolutely, Janie. That's very much the risk. We know that the government has baked in $12 billion worth of savings in the aged care budget over the 10-year period that they projected the savings out to. And that's because these contributions that older people are being asked to make, they're not held by the providers as extra money. Those contributions actually reduce the subsidy that the government pays the aged care provider. So that will be, you know, a net good effect for society, but potentially a net negative for the individuals who have to pay the higher cost.
Yes. So what could be compensated here for people that are really in that high necessity cohort?
Yeah, so the big thing to say is there are hardship provisions available. So if you are having difficulty affording aged care services, do put in a hardship application to Services Australia, because you may be eligible to have those participant contribution costs covered by the government.
All right. And talk us through some of the packages, because we've spoken before, there's been a number of packages, but again, we're in an ageing population. So what are we looking at in terms of the bigger picture here, and how much money is going to be provided for the government, and where is that money going?
Yeah, so the additional revenue the government plans to get from this, the expectation is they will be providing more home care packages for people who need it in particular. So we know that the government's own projections indicate we're going to need around 34,000 additional home care packages every year for the next 20 years just to remain where we are now, not digging into any waiting lists that exist. We know there are 120,000 older Australians waiting for a home care package as of today. There's another 120,000 who are awaiting an assessment of their level of need. So that's 240,000 older Australians not receiving the care they need at the moment. But the government has committed to releasing 83,000 additional supported home packages this year.
All right. Yeah, plenty to digest there, but thank you as always, Paul. Great to see you.
Thanks, Janie.